Welcome back to the lecture series on repertories. Today we are going to see the topic difficulties in taking a chronic case. First we will see the introduction. Ever since the birth of homeopathy, much importance is given to the case taking, and teachers always said to their students that a well taken case is half cured, but everyone faces difficulty in taking chronic case, and without the proper case, drug selection is difficult. Here is an attempt to trace out these difficulties and attempt to find the solution of these problems. First, let us recall the definition of chronic case. A chronic case is defined as a case which has a long history of its existence with a miasmatic background. In the course of progress and development of a chronic disease, the individual passes through a slow and gradual change in his functioning and finally loses his capacity to function efficiently. Only when the individual realizes that he is no more able to function efficiently or effectively, he seeks the opinion of a physician. Case taking is essentially a social interaction between a physician and a patient under certain predetermined conditions. We have to face many difficulties because of the ignorance of the masses who are not accustomed to a detailed narration of their sufferings to enable us for a homeopathic prescription. Our task is made even more difficult by the easy methods adopted by the modern system of medicine, bringing the masses who are accustomed to the easy methods and impressive instruments to the simple but the surer method of cure is a difficult task. We must understand that there can be no substitute for human brain and that no instrument can understand the human sufferings, and only a human mind can realize the depth of the sufferings. When the physician interviews such a sick person, some difficulties might come in the way of case taking. Some of the difficulties are discussed below. Now we will see the first difficulty, the gradual onset. As the chronic diseases are gradual in onset, in most of the cases, the patient even does not notice its appearance. Thus, it is difficult for the patient to remember the accurate time of its onset. It is difficult to ascertain the accurate time of its beginning. The second one, difficulty in recalling the symptoms. The onset is gradual and the patient usually meets the physician as it becomes difficult to adjust with evolving symptoms, which is often after a long time since its appearance. This creates the situation that the patient is unable to recall the initial symptoms the history of evolution of his symptoms, and any triggering factors are not pursued which are said to be the cause of the disease. This makes the physician only able to develop a partial picture of the chronic disease. In such cases, only a few striking changes in the health are mentioned to the physician, thus acquiring all the components of the initial symptoms will be difficult for a physician. Next point we'll see. Initially, when a disease starts with few trivial symptoms, the patient does not attach much importance to them and tries to think that they are insignificant. Only the subsequent grave changes are remembered. Therefore, there is a tendency to present only a partial picture of the disease in a chronic case. Fourth one. Generally, in chronic case, a patient does not come to a physician in the beginning. The realization that he is sick occurs late in a majority of the cases. Even when some realize it, they try to take some kind of palliative treatment by themselves due to various reasons, or might seek the help of some non-medical person. In the process of seeking relief from symptoms, a considerable time is wasted and the disease picture is greatly altered when he finally reports to a homeopathic physician. Therefore, the physician may find it difficult to understand the whole phenomena of such case. The fifth one, modesty conceals the facts. Modesty conceals the facts. There are certain conditions and sufferings which the patient may not like to disclose to the doctor due to modesty or shame. Due to modesty, patient conceals the facts and gives vague symptoms which make the correct prescription difficult. For example, habitual masturbation, leukorrhea in females, attempted suicide, excess of wine, alcohol, infection with venereal diseases, unfortunate love. These gives us vague symptoms which makes the correct prescription difficult. Now we will see the sixth point. Periodically appearing symptoms are not narrated. There are certain symptoms from which patients suffer constantly along with these symptoms. There shall be symptoms such as headache appearing periodically, once in 2 weeks or once in a month, diarrhea appearing during rainy season, rheumatism in winter, constipation in summer. He will narrate only the present complaints. Due to lack of knowledge, the patient may consider some symptoms as an expression of health due to their long-standing presence. In such cases, many concomitants and auxiliary symptoms are not narrated to the physician. In some chronic cases, the patient has alternating symptoms like joint complaints in summer and respiratory complaints in winter. In such cases, they mention only the presenting complaints and forget to mention the other components. Hence, the physician does not get a complete picture. Now we will see the next point. In the case of chronic diseases, all the deviations on the physical and mental planes should be obtained from the patient in order to form a portrait of the disease. Due to lack of understanding of the homeopathic physician, sometimes the patient does not cooperate while taking the case and does not share his symptoms in relation to emotions and intellect. In such cases, constructing a totality would be difficult. It is a totality not arrived at. The case taking remains unfruitful. Next point we'll see. Chronic cases comes to a homeopathic physician generally after the patient has taken long, palliative and suppressive treatment. Thereafter, the entire picture and presentation of the disease is different. In such cases, it is difficult to obtain an original, unmodified picture, which is very important aspect of case taking. Now we'll see the 11th point. Habitual to long sufferings. Patient gets accustomed to the long sufferings and may not feel the necessity of narrating the symptoms which have lived for long time. Several symptoms becomes a part and parcel of patient's life. They do not consider that they have anything to do with the prescription. They may not feel it important to speak out. For example, sneezing in the morning, blocked ears, constipation, etc. The next point, self-medication. There are certain patients who take medicine of their own without consultation. Difficult to elicit actual picture of the disease. The next point, 13. The influence of the modern system upon the people. The physician trained into modern methods of treatment does not trouble the patient much by the way of asking questions for case taking. Even if the patient wishes to tell him something concerning their symptoms, then physician examines the eye and prescribe for the eye. Patients are also accustomed to such procedures and influence. 14 point. Indolent patient. There are individuals who would narrate less than what they feel because of their indolent nature. There are the patients who are suffering from very grave diseases, yet they do not complain anything about their conditions. These individuals refrain from mentioning a number of their symptoms and they describe in vague terms. Next point we'll see, 15th one. Patients who have undergone unhomeopathic treatment from the homeopathic physicians. Patients coming after treatment with homeopathic combinations, external applications, partially similar medicines are difficult to treat as they form a complex disease and never provide a clear totality of symptoms by case taking. Now we will see the 16th point. Pretension modifies the symptoms. There are the patients who exaggerate the symptoms, and because of hypochondriasis, they narrate more than what they feel. These are called as hypochondriacs, and other persons of great sensitiveness and impatient of sufferings portray their symptoms in vivid colors in order to induce the physician to give them relief. There are some patients who narrate less than they feel. These are the patients who suffer from grave disease, yet they do not complain about their sufferings. They hinder the proper case taking. They give the wrong impression of the intensity. The next point we will see. The lack of proper expression of symptoms. Some patients are not able to express their subjective symptoms and mental symptoms in proper phraseology. They are not able to convey the proper words and intensity of the symptoms. 18th point. Introvert patients. Many patients are not comfortable in initial visits to tell all the symptoms to the physician. They are not able to form good communication with physician because of their introvert nature. 19th one. Mixed miasmatic disease. There are certain diseases which have a combination of sora, syphilis and psychosis in a complex. It is very difficult to penetrate in these diseases. Difficulties due to physician. The first one, patient coming from other physician who prescribes unhomeopathic medicine. When a patient comes from other physician's hand, which was treated with lots of medicines, thus the symptoms and feelings of the patient due to previous course of medicine do not furnish the pure picture of the disease. Second one, lack of knowledge. Due to lack of knowledge of the case taking, the physician cannot receive the data from the patient verbally and non-verbally. That means by observation. He may not have command on case record pro forma along with the knowledge of all subjects of branches of medicine. The third one, doctor is prejudiced. If physician is prejudiced, then his observations will suffer. He will try to confirm his remedy by asking leading questions to the patient. Fourth one, lack of rapport with the patient. Homeopathic case taking is an artistic method along with scientific method. Even if physician has command on all branches of medicines and case taking pro forma, but his communication skills is not good enough, then there is no linear transaction between patient and physician. He will not receive the actual symptoms of the patient. The patient will not be comfortable to ventilate. So, it will not be the good case taking. Fifth one, impatient physician. The homeopathic physician should have the patience to listen to the patient and undergo an interrogation to obtain an essential qualitative totality needed for a logical prescription. Some doctors are in a hurry and they make patient in hurry, because of which they may miss the important prominent feelings, expressions or observation about the patient. Patient may not be properly ventilated because of the impatient nature of the physician. The physician lacking knowledge about the art of case taking. Case taking is not a clerical work of writing everything narrated by patient to compare all of it with the symptoms of different medicines. Those who have recognized it as a different process, only those physicians can be said to have understood the art of case taking. The physician should develop the skill to ascertain the symptoms needed to move on to a curative remedy. Now we will see the difficulties due to the disease. A pathology process and signs and symptoms decreases in proportion as the pathology progresses. The signs and symptoms decreases. In the absence of signs and symptoms, the choice of the medicine is not possible, and on pathology alone it becomes difficult to prescribe. The second one, change symptom image. By the time a patient comes to a homeopath, he must have consumed a lot of strong drugs continuously for a long time. Over-drugging must have produced their own symptoms and changed the symptoms of the original disease. The third one, maze of symptoms. In some cases, there may be plenty of symptoms at a time. It becomes difficult to collect them according to their evolution, chronological order and hierarchy. The fourth one, development of complex diseases or artificial chronic diseases. The patient made to get the treatment from other systems of medicine produce their own symptoms and will be presented mixed with the already existing natural disease to form a complex disease which is difficult to cure. Totality of symptoms, which include the characteristic symptoms, patient aids in the selection of remedy for the case. As the disease progresses to reach pathological changes, it is difficult to elicit characteristic signs and symptoms to select a simillimum of the case. Fifth one, the suppression of disease condition. Many medicines, ointments, mixtures suppress the disease condition. The physician should take the caution that if there is any reason for the symptoms presented by the patient which may be the result of suppression of any other symptoms, due to any means or non-homeopathic treatment. The physician should ascertain this history, which the patient may not be aware of, to remove the obstacle and call for cure. 6.1. One-sided diseases. One-sided diseases are the diseases with few symptoms that display only one or two principal symptoms which obscure almost all the others. Now we will see the difficulties due to circumstances. Pediatric age group first we'll see. Patient may not be able to give case history properly. Physician has to depend on observations of parents regarding the magnitude and intensity of the symptoms. In case of children and in persons with communication problems, it would be difficult to understand the exact sensations in such cases. Obtaining the correct and whole picture would be a difficult task. Second one, now the old age group. In these cases, the life history is long and patient may not remember the exact past and family history, as the exact history may not be available for known by them. Old age patients forgets many things to convey to physician because of poor memory and lack of recollection. They are very slow to talk. They cannot hear and understand properly. They may become emotional at some point of conversation. Lot of patience is required while taking the case. Third one, language barrier. If the language of patient and physician is not same, then the physician cannot understand the symptoms in the language of patient and it becomes difficult to convert it into the clinical language. Fourth one, unconscious patient. Subjective and characteristic symptoms are not available. Mentally ill patients. Physician may not get the exact case history. 6.1. Deaf and dumb patient. It causes insufficient communication from both sides, patient and physician. Thank you for listening the lecture on difficulties while treating the chronic case. If you like the lecture, then please do like, share and subscribe. Thank you and see you soon with a new video on repertory.